A very good day to my new postgraduate students who are most welcome to the wonderful world of pathology. In this short lecture of mine, I had chosen the wedding as an analogy, and you are all getting wedded to pathology. A successful marriage requires falling in love many times, but always with the same person. I think that's a nice quote. Marrying somebody whom you love and loving somebody whom you marry are two different things. There is a wonderful picture on the screen, courtesy, photo library. Such a world of wonder you people shall unravel during the future of yours. We had seen this. Probably some of you will be able to recapitulate what it was as an undergraduate slide for you. But then it can still come as a short question for us, and you might be able to explain what it is. But what we are more interested is in the splendor Hopley phenomenon in the case of actinomycosis. What are your comments to the picture on the screen? I give you half a minute time. Neatly building castles in the air. I have used this pertinently. Neatly. We are so very tailor-made to the NEET exam that we are going to face the reality in life now. And it is like building castles in the air. Why do I say so? Now that you people have scored well and got an entrance into whatever course you like, can you explain? Can you teach? Can you justify? Can you present? Can you build an art without a foundation? So this will be very much needed. And what I mean by the word foundation is the very basic subjects that we have seemingly crossed, but yet not. You can't build a great building on a weak foundation. So the message that I'm going to deliver today is of paramount importance to you. Go back to your basics. These are the words of my professor in JIPMO when I was a senior resident a few decades back. Be strong in your basics and nobody can shake you. Definitely you people will be able to identify this. Okay, good enough. And then what is this? This also you might be knowing. And what is the relevance of this? It is not that you are going to be given a programmed question. So you'll have to diagnose and then answer. Instead, you would be asked to identify, correlate, explain what are the manifestations, complications. It can come as an autopsy case for you, or a compiled autopsy case for you, or anything else. And there is going to be a battery of questions that will be thrown at us at the end of 3 years. So it is the correlation that matters, which needs familiarity and repetition. So thanks to cartoon stock, beautiful thematic picture. So we are finding there has been a very tall building that has been built. Not knowing the basics is like building on a poor foundation. And what do I mean by basics? Those are your own subjects which you will have to visit, revisit, and read in a different way. What is your diagnosis? Good. Some of you have messaged me as koilonaikia. What is it actually? But what am I seeing in this? The nails are pale, they are brittle, they are spoon shaped, they lack luster or shine, and they are showing longitudinal ridges. Fantastic description given by my medicine professor, Professor M.S. Ramachandran. Now, all these are not of great importance to us, but then when you come to pathology, you are half a clinician. You should know the clinical presentation, the radiological correlation, the surgery that can be done on it, and of course, the pathological diagnosis. So it is an armamentarium that you will have to possess. Nice. So many of us like colors, and sometimes always we carry some. Can you tell me which chapter it is from? Okay. Pigments. And your Robbins described these as memories of bygone follies. Sometimes I would have engraved the name of my lover in my skin, and it haunts me forever. And when you go to the text of Robbins, you find that there are a plethora of pigments and a play of colors. The modes of diagnosis, the pain it inflicts. I'm just showing you a few examples to give you a glimpse of the vastness of pathology. And dear students, what and whom are we seeing on the screen? Definitely you people should be knowing the name is over here, Sir Stanley Roberts. And it is a book that we should possess. And when I say a book, we rush to the latest editions, not to the first or second, in which we will be finding a fluency that has to be born and it has to be possessed, it has to be delivered. For example, an embolus is a solid, liquid, or gaseous particle that causes obstruction distant from its site of origin. Or an infarct is an area of localized necrosis caused by the sudden, complete, and irreversible occlusion to the vascular flow. Memories of bygone follies in the pigments. There are a lot such things which you people should relish and read, retain, and pass on. This is something new. So you will have to maintain a lot of secrecy over here. I told you it is wedding. So you will not share the password with anybody else. Good. And this is a neat wedding. What you people have now gone through. It is like getting married to someone you have never seen. In the need, you are thorough with all the vagaries of medicine, all the subjects you knew intricately, but you do not know the person whom you have got married to. Pathology in our case. And can you guess the range of questions from this picture? Giving you a choice and then making you people choose the answer is something different. But that is one type of exam. We shall be visiting that later on. But in this, you find that there is a clinical picture, I told you, you are a clinician yourself. Guess. There is a frothy sputum. So, a pulmonary edema. Then a left heart failure. And then there can be the cardiac failure cells or the macrophages. And what are all the other things? What is an edema, etc. You find it goes on. So you people should be very familiar with your basics. So what I would mean very much is, look at these pictures, amazing. And the credit goes to the person net. Two extremes, and the pictures speak for themselves. The pictures speak for themselves. So you have got one person who is frail. He is leaning forward. You can count the ribs. And also you find that there is a purse string breathing. Another person, he is bloated. He is more bluish. So these have been described as a pink puffer and the blue, which of course come in a chronic obstructive pulmonary disease. Both are so near and yet so far. So tomorrow, you people should be able to analyze and answer each one of these. And this is the wonderful contribution. Not only is it anatomy, but also pathology. You find that sketches are simply superb by Netta. To get the full value of your joy, you must divide it with someone. Obviously, I would say that your friends, your colleagues, they are going to be the greatest teachers, your seniors. Then only come all of us. Otherwise, your life will be one that Victor Hugo has described, Les Miserables. See this charming one, an eye-to-eye contact. And always it is said that knowing the basics is like the wedding yielding a fruit. So this is obviously a fruit of a wedding. And always tend to be positive. Pathology, in fact, is quite pessimistic. In the sense, the code that I originally designed was this. Not knowing your basics is like a wedding without yielding a fruit. But that is too negative. Let us choose the positive side of it and go towards it. A couple of pictures over here, which you will have to correlate and conquer. Incidentally, this Arcana Laboratories, a wonderful set of pictures, highly informative, particularly in the nephropathology. So there is a pulmonary osteodystrophy, a grade 4 clubbing. And here there is some deposition in the glomeruli and perhaps the tubules also, amyloidosis. What the pathologist thinks today, the clinician does tomorrow. William Osler, again another person, very great. He is a clinician from Canada who has said, as is your pathology, so is your medicine. And this is the source for it, thanks to this person, Kalyani Bamba. And these are the sources you people can go to it. There are quite a few quotes which you people can pick up from this reference. Highly informative. Thank you. Not understanding is also a milestone. You people have stepped into pathology and you're not going to understand it for the next few months. But then it is something like this. You are a child and a child is scribbling. It is learning. It is learning so many things. The colors, the pressure, the paper, the contrast, the direction. We do not know what is being registered in the mind. But please do remember, you are learning every minute, every day. And your time starts now. There are batteries of topics or chapters which you have already undergone or studied. And these are all the lists that is given over here. I'm not very happy with it, but please do remember that there are about 758 undergraduate questions which you people should know within a short span. And when I say know, it has to be knowing thoroughly. Bronchiectasis, for example, is a permanent irreversible dilatation of the bronchial tree distal to the second degree of division, because the first two degrees are supported by cartilage. Such should be your fluency. Go back. You have not missed anything, only the continuity that you people will have to pick up within the next 30 days. It is not learning a language in 30 days, you are learning your life in 30 days. And amazing one. No? So you find that how much they relish the relationship, the fruit of it, etc. Maybe this is only a kid's job, but it matters most, without which the life would have been meaningless. See you in time and tide. That shall be my next talk to you.